Hello friends, this is Professor Dr. H.M.P. Singh. We are going to discuss today acute coronary syndrome. As you know, this is one of the very important topics for our undergraduate program, and I am going to discuss this into 5 parts. In the first part, we will deal with the introduction and epidemiology, followed by pathophysiology of acute coronary syndrome. Approach to suspected acute coronary syndrome, what should be our approach? Then how are we going to diagnose, and particularly with ECG, which is very important tool, and then a brief on the treatment and management. Let's see on the first part, how do we define acute coronary syndrome, and also the global data, what is the status of this disease world over. As you know, this is a syndrome. This is not one particular disease, and it comprises of 3 important segments, which carries ST segment myocardial infarction, which comprises around 30% of the total burden of this disease. Non-STEMI, this is again carries around 25%, and unstable and stable angina, which comprises of 38%. This is due to decreased blood flow into the coronary arteries, as you are aware, and the heart muscles are not able to function properly, and in due course of time, they are going to die. The patient usually presents with a chest pain, retrosternal, radiating to the shoulder, angle of the jaw, crushing in nature, centrally associated with nausea, sometimes vomiting, and profuse sweating, palpitation. These are some of the features by which you diagnose this particular disease. Let's go further and see that what is angina. Angina primarily is either a angina, stable angina, or it is a unstable angina. As you see in this picture, that there is a atherosclerotic plaque which is occluding around 40% or more of the lumen of the coronary arteries, and on top of it, when angina comes, it comes with a pain on exertion. And typically, the angina is less than 20 minutes, which is due to exertion, and then subsides on rest. Apart from this, there are other factors also which are contributing to the angina, that is the coronary spasms. It is also associated with emotional stress, also with some sort of exertion and prodromal conditions. Pain with or without exertion more than 20 minutes is unstable angina. If you look at the picture down, the unstable angina has subtotal occlusion because there is a thrombus also which has invaded on the top of the coronary atherosclerotic plaques. Angina sometimes is resistant to the drugs, that is called a refractory angina. And with a previously it was reacting or giving responding to the treatment, over the period it does not respond, and that is also one of the factors. In many of the situations of angina, ECG may not show you anything. Sometimes there may be ST depression and there may be some T wave changes, but by and large the diagnosis of angina is done by a presumption or by the clinical sense. Whereas in acute MI, the chest pain is very severe and it is crushing in nature. Associated with that, there is a occlusion of the lumen, if you see in this picture, and it is almost at 90% occlusion, which is there, and there are rise of cardiac enzymes. The troponin T, which is commonly done in Malaysia, also the CPK MB fraction, which rises more than 20%. And then there are ECG changes, STD changes. There may be a pathological Q wave. The coronary angiogram is the diagnostic tool for all these things. There is a myocardial necrosis which occurs, and it may be a non-STEMI, that there may be no ST segment elevations or There may be some symptoms with positive cardiac enzymes. On the other hand, STEMI is the ST elevation, and there are ECG changes as well as the symptoms. All these makes this whole set of syndrome into acute coronary syndrome. If you look at the burden of the heart disease, and globally, if you look at the thing, it is having a global cause of, it is one of the leading global cause of death. This data which is showing, I am showing you around from 2010, 17.3 million deaths per year. And it is expected that it is going to grow to 23.6 million by 2030. In 2008, cardiovascular deaths represent 30% of all the global deaths, and 80% of those deaths taking place in low and middle income group countries. In nearly 787,000 people in US died from heart disease and stroke and cardiovascular diseases in 2011. And this is about 1/3 of the total deaths in US. About 2150 Americans die each day from this disease, and one every 40 seconds. Direct and indirect cost of this disease, you can imagine, is $320.1 billion. And in this country also, it is quite high because the state is sponsoring 80% of the health services here. If you look at the data, which is again showing that this disease is prevalent in some parts of the US. I did not get any data from Malaysia regarding the prevalence in some states, but it is equally good in this country as well. You look at this data and you find that the south states and eastern states are more vulnerable to this disease as compared to the western and northern states. And if you look at the ethnic data, the American Indians, Asians or Pacific Islanders, non-Hispanic whites, they are all suffering from this disease to the tune of 23.5%. Annual number of heart attack by age in US, this is the AHA statistics, American Heart Association, and you see that the disease is increasing in females after the postmenopausal age, whereas premenopausal age, the males are more affected as compared to females. If you look at the CAD mortality in Asian Indians compared with the people of other ethnicities, Indians have more coronary artery disease compared to Chinese and Malay. This data is from Malaysia. And you can imagine that why Indians have maybe their habitat, but it is also postulated that their coronary artery lumen is narrower as compared to Malay and Chinese. That is one of the reasons given for this disease more prevalent in Indians. If you look at the coronary artery disease in Malaysia, it is seen that Malaysia ranks 33 as per the WHO data, which was published in 2014. And this is, Malaysia reached 29,363 deaths per year, or 23.10%. Their adjusted death rate is 150.11 per 100,000 population. So you can see that Malaysia is also having this disease very important, and it is on rise compared to the European or the US. And this reflects that we should do something to prevent this, to reduce the state burden. This is all about the part one. I will see you in the next part. Thank you so much.